great to hear the New York Academy of Medicine is actually older now. I learned from the National Academy of Sciences and, of course, the Institute of Medicine that was born some time ago. I always like to start with the preamble of the Constitution of the WHO. Informed opinion and active cooperation on the part of the public are of the utmost importance in the improvement of health of the people. And so much of what we need to do is aimed at how do we improve this. So I believe health literacy has great potential. A lot of work we've heard, certainly here in the United States, that many of you have been engaged with, the United Nations pieces that we've heard about. We've published quite a bit in the Journal of Health Communication over the last 17 years, and a number of action guides that Dr. Apple's put together you'll hear a little bit about later. But when I've been presenting this, I have stolen, if I can say, I've taken Ruth Parker's slide and say this is a pie-in-the-sky idea. How can we really move health literacy in a way that will make a difference for everyone? And even this pie-in-the-sky is not culturally sensitive around the world. When I presented this in Brussels, and I can ask Ilona how this translates in Germany, but I know that it didn't quite work in some cultures. But it does remind us that this is a big idea, and it's something that's going to take a lot of time and marshaling forces. So as you know, years ago, Ruth and I and Marcia Zorn from the National Library of Medicine, and Catherine Selden and others did a current bibliography of medicine. And in the review, we retrospectively looked at all the articles at that point that were published on health literacy and came up with this definition. And just simply, now that we're hearing more mobile, important to obtain information, process information, understand information, and make appropriate health decisions. Key to this definition also is it has services in there, and so much of what we do is also how we deliver health care and what this means in the future. And as you see, this is part of the Affordable Care Act, and I won't be going into depth here today, but there are specific activities that you'll hear later, perhaps from Cynthia next, on where this fits in the United States. This is the framework that Ruth has presented. Just to remind, I think it fits well with what Jacob just mentioned. On the left, many people think it's what health education and the individual level of skills and ability. And on the right is the healthcare quality discussion. How do we simplify the demands and complexity of the system? And health literacy is that space in the middle. Well, fortunately, there's been a number of discussions on health literacy that have gone beyond New York, Brussels, Geneva. And George and I were at a meeting in Beijing that the United Nations ECOSOC held on promoting health literacy. It was the first UN meeting that I know of on this. And months later, the Chinese health minister stood up in Geneva and this declaration was made at the ministerial level. We stress that health literacy is an important factor in ensuring significant health outcomes, and in this regard, calling for the development of appropriate action plans to promote health literacy. This was the beginning in 2009. And as you heard from Stephen, 2 years later, the first time ever on non-communicable diseases, only the second time convening on health issues, there was a highly negotiated number of recommendations that came into play. And this was one I think that was most key on health literacy, to develop, strengthen, and implement as appropriate multi-sectoral public policies and action plans to promote health education and health literacy, including through evidence-based education and information strategies and programs in and out of schools and through public awareness campaigns. I say this is key for anybody in the UN area. This was not only supported by Switzerland, United States, G77, European Union, but very specific on the language of not to make health literacy the same as health education. And also to remind that health literacy is not just what's done in the schools. Well, that might work for MDG 2. It's not necessarily only going to be basic schools, so in and out of schools and the public awareness campaigns. It goes on to say, from some of the work in Australia and others that predominantly mentioned, that some of these are in early phases. So a lot of this now is how do we implement this non-communicable disease action plan to try to have a 25% reduction by 2025. The European Union at the same time had a European Union high-level pharmaceutical forum. I was able to be a part of that, and that's where I also enjoyed learning about health diplomacy, really in action as both an American and a private sector non-representative. We certainly worked hard for getting health literacy there, and clearly this is the key. I think the final term is just promoting health literacy and health information in the broadest sense. And this is something we'll hear later, I think, from Christine about the work that's been done in the European Union as well as Switzerland being added to that mix. It's a U.S. priority. We have heard from Howard Koh, other assistant secretaries in here, and then action plan has some of the key areas. I think probably the best piece, and thanks Cynthia Brock and HRQ and all the other ones who've been engaged, is to remind us that health literacy is important to make health reform a reality. And without health information that makes sense to them, people can't access cost-effective, safe, and high-quality health services. And in this regard, we have a lot of work being done with Len and HRSA and others around on how we can actually make this health reform a reality. So this is a slide that has some ideas of the different pieces of what's being done globally, internationally, and national momentum. On the far left, we've heard already about the National Action Plan for U.S. health literacy, the ministerial declarations that are there at the IOM, which means every member state has signed up or agreed to some of those actions, the European Union resolution, and right now some member state actions that we'll hear more about. There have been a lot of public health advances, and health literacy coalitions and public-private partnerships are really growing here in the United States at the state level. Andrew and I last week were at New Jersey Health Literacy Coalition. We have Missouri on our roundtable. There's a whole variety of these. I think 24 states have activities at this juncture, and many more are developing these at both the state, city, county level, not to mention the regional ones in different parts of the world. The health communication and literacy is integrated in health professional training. I know not only the HRSA work, but UMDMJ and many others. The competencies for the 21st century medical training. With the MCATs, the medical entrance exams for the United States changing, behavioral and social sciences are going down to the undergraduate level. There's health literacy opportunities there. And then finally, how the non-communicable diseases might be the genetics. And on the far right, I put private sector programs. We'll hear a little bit more about. These may be private sector programs led, such as health checklists or scorecards. But these are also private sector engagement and workplace. Clearly, while the private sector's workplace, still the largest employers are, in many cases, of course, governments. And then finally, I think we need to continue to have more campaigns and innovations. And the M-Health piece has already been massaged quite well from Jacob and the slides that he showed where the WHO and ITU and others are looking at this new area. So these are the checklists that I've been finding because we're an evidence-based, theory-based, science-based group here at the Institute of Medicine. These are the ones that have the best evidence to date. And frankly, all of these are aimed at the learned intermediary or a health professional or a health worker. The central line ICU checklist, so 5 points. As I mentioned, 28,000 tests in the US. This has really found its way into a whole variety of activities around the world. The surgical safety checklist, this global rollout continues. And what's most interesting, it also empowered the whole surgical team. So it wasn't just the surgeon who partakes in it, but the surgical team to ask the questions. And that's made a huge difference and continues to be really the proof of concept that what we learned in aviation, what we learned in manufacturing, what we learned in engineering can be applied to healthcare. The Safe Childbirth Checklist is the one that's been in India right now, and the Harvard study has basically shown that this program works. Those in communication might say a 29-item checklist is too long, but they have shown that there is movement in the right direction, and this is being scaled there. And I think I can presage later this week in the UN Commodities Commission report on life-saving commodities, they will be mentioning the suggestion to scale this up in at least 5 countries within the next year, and all every woman, every child countries in a number of years. So we believe that there's great business opportunity here. The 7-day tool is 7 days postpartum. That's the first MCheck tool also developed by WHO. So we published this report that's coming out tomorrow. I served as editor with Jonathan Spector at Harvard of the potential for checklists, what we call for the last kilometer. And our group, which included not only a tool and WHO and other folks, have come up with the idea that checklist programs can work in different ways. I have some of these available. It will be posted on the WHO website. But what our task force came up with is we can look for other areas, such as birth preparedness. There's nothing that exists for a checklist in the last 30 days for women during pregnancy, also for her family or carers or caregivers. So we think there's an opportunity there, and there's other places that we put in the conclusion that health literacy can make a difference, not just for the health intermediary, but for the individual patient or consumer, and that's where mHealth is so powerful. How do we take these innovative ideas and how do we make them practical? How do we really move that? As we know, sifting evidence for sound studies and the take-home message is laborious and the yield disappointing. We have to take many shots on goal if we want to actually have something be successful, and I believe there are a number of innovations with checklists and scorecards that can help with health literacy. So the scorecard idea actually came, I can thank Marcia and the National Library of Medicine. I gave a lecture in 2000 called Quality Communication: A Path to Ideal Health. And I looked at Martin Rees, who wrote a book on just 6 numbers that explain the science of how the universe came. And I thought that why don't we do this, just the 6 numbers, and we could have something for health. And in the midst of that, reporting the numbers of health status, generate dialogue and safety behavior, and integrate with technology. We look more now 3 years ago on promoting health literacy to encourage prevention and wellness, where we presented the scorecard idea. And at that time, we had great dialogue and really support for the effort. I continue to help present this and hone down and write about it. And as you see at the top, we had cancer screenings and exercise immunizations. And in the midst of actually writing about this, Peter Anderson was guest editor of the Journal of Health Communication we did on communicating and non-communicable. He really suggested, well, we need to put in alcohol. So alcohol has been added because the standards have changed so frequently on cancer screenings that are very different in different parts of the world. We put alcohol, and we now have 7 numbers that are there. And we believe that the scorecard can help make a difference in that regard. The World Health Professions Alliance adapted the scorecard last year at the this time and later at the World Health Assembly earlier this year. And basically, that includes 7 risk factors as well, the similar ones that we put on the scorecard. And just for those of you who don't know who the World Health Professions Alliance is, it includes the World Medical Association, the International Council of Nurses, the Federation of Pharmacists, the International Dental Federation, and the Physical Therapists Organization. All of those are 26 million health professionals, and they're working how they can diffuse a discussion item that might not be health literate at this juncture, but they're certainly working on making this available for their health professionals initially, and hopefully for individuals. The digital scorecard is the last piece. I have about a minute or so left, so I'll just mention that we've been looking at how we take the scorecard for online and mobile, and there still is a digital divide for online, but mobile is bridging the divide. Mobile is reaching people at the right time, in the right place, in a personal manner. So we think that we can do a Score Your Health or Score My Health and create a score that will help people know directionally where they are with risk factors for non-communicable diseases. Checklists and scorecards have been a major global impacts for patients and consumers. NCDs are in place. And maternal and child mortality, we think there's great opportunity there. And even infectious disease, particularly as infectious disease is bridging in some areas into prevention of chronic disease such as cancers. Better use of information from new technologies. This will continue to expand globally. And as the workforce is strained and growing, we nonetheless think that new technologies can empower the consumer or the informed patient or more health literate individual. And then finally, the mHealth communication. I think that there's great promise. We have to think about using mHealth in the right way, both with mobile devices and information, but also as mobile devices to provide information that we can scale and measure and evaluate. So with that, I've hopefully given an overview. As you see, our roundtable spurs a lot of ideas. Some of these innovations we take into practice. I know there's people, and thanks to Linda for making this webcast around the world. I think there'll be lots of opportunities that we'll continue to hopefully share from today in the future as we hope to all make a difference with health literacy. So thank all of you here today.